Have you ever gone to your doctor's office, sat down for a quick blood pressure check, and then heard something that made your heart sink a little? Your numbers are high, and maybe you thought, that can't be right, I feel fine. Or the opposite happened. You were told everything looked normal, even though deep down you didn't feel quite right. Here's something that might surprise you. A lot of blood pressure readings, both at home and even in clinics, aren't as accurate as we think they are. Not because anyone is doing anything wrong on purpose, but because there are small, everyday mistakes that can quietly throw off those numbers. And the truth is, those numbers matter. They guide decisions about medications, lifestyle changes, and how seriously we take our heart health. A difference of just a few points can change everything. So today, I want to talk with you about something simple, but incredibly important. We're going to walk through some of the most common mistakes people make when measuring blood pressure, and more importantly, how you can fix them right at home. Because when you understand how to measure it correctly, you take back control. You stop guessing. You start seeing the real picture of your health. Let's start with something that almost no one talks about, but it can make a big difference. One of the most common mistakes is measuring your blood pressure when your bladder is full. Now, I know that might sound like a small detail, but your body doesn't see it that way. When your bladder is full, it actually activates your nervous system, the part responsible for that fight or flight response. Your heart rate goes up a little, your blood vessels tighten, and just like that, your blood pressure rises. We're not talking about a tiny change either. For some people, this can raise the top number, your systolic pressure, by quite a bit, enough to make a normal reading look high. Imagine this. You sit down to check your blood pressure in the morning. You haven't gone to the bathroom yet, you're in a bit of a rush, and the reading comes back higher than expected. That moment of worry you feel, it might not even reflect your true health. Something as simple as taking a minute to empty your bladder before measuring can make your reading much more accurate. It's one of those small habits that can quietly protect you from unnecessary stress and even unnecessary treatment. Now let me ask you something else. When you measure your blood pressure, do you usually use just one arm? Most people do. It feels natural. You pick a side, you stick with it, and you don't think much about it. But here's the thing. Blood pressure is not always exactly the same in both arms. A small difference is normal, but sometimes that difference can be bigger than expected, and that can actually tell us something important about your circulation. If you've never checked both arms, you might be missing that information. Let's say your left arm gives you a reading that looks perfectly fine, but your right arm is consistently a bit higher. If you never check, you might assume everything is okay when, in reality, your body is trying to give you a signal. That's why it's a good idea, at least occasionally, to measure both arms. You don't have to do it every single time, but doing it once in a while helps you understand your baseline. And if one side consistently reads higher, that's the arm you should use moving forward. It's not about making things complicated. It's about getting a clearer, more honest picture of what's really going on inside your body. Now, let's talk about something that happens all the time, especially at home. You sit down, maybe on the edge of a chair or the couch, you quickly wrap the cuff around your arm, your feet might be crossed, your back might not be fully supported, and you go ahead and press the button. It feels quick and convenient, but your body position in that moment can actually change your blood pressure reading more than you realize. When your back isn't supported, your body has to work just a little harder to stay upright. That subtle effort can raise your blood pressure. Crossing your legs can do the same thing. Even small muscle tension can affect the result. The goal is to let your body relax as much as possible. Think of it like this. You're trying to measure your resting blood pressure. But if your body isn't truly at rest, the number you get won't reflect your true baseline. So instead, take a moment to sit comfortably. Let your back rest against the chair. Place both feet flat on the floor, uncross your legs, let your hands relax. It might feel like a small adjustment, but it creates a completely different environment for your body, one where your heart and blood vessels can settle into a more natural rhythm. And that leads to a number you can actually trust. There's another detail that often gets overlooked, and it has to do with your arm. When you're measuring your blood pressure, where is your arm positioned? For many people, it's resting on their lap, or sometimes it's just hanging at their side. It feels comfortable, but it's not ideal. Your arm needs to be supported, and it needs to be at the level of your heart. If your arm is too low, gravity pulls the blood downward, and your reading can come out higher than it really is. If your arm isn't supported, your muscles have to stay slightly engaged, which can also affect the result. A simple fix is to rest your arm on a table or a desk. Let it relax completely. Make sure the cuff sits around the middle of your upper arm, and that it lines up roughly with your heart level. It's not about being perfect. It's about being consistent and mindful, because all of these little details add up. Now, here's another situation that might sound familiar. You've been moving around, maybe walking, maybe doing chores, maybe just feeling a bit stressed. You sit down, wrap the cuff around your arm, and check your blood pressure right away, and the number comes back higher than usual. That can be frustrating, even a little scary. But what's happening here is actually very normal. Your body needs time to settle after activity or stress. Your heart rate slows down, your blood vessels relax, and your nervous system shifts back into a calmer state. If you measure too quickly, you're capturing your body in that active mode, not your true resting level. Giving yourself just a few minutes, about 5 minutes of quiet sitting, can make a big difference. No talking, no scrolling on your phone, no distractions. Just sit, breathe normally, and let your body calm down. Think of it as giving your body permission to reset, and when you do that, the number you see on the screen becomes much more meaningful because it reflects you at rest, not you in motion. And once you start paying attention to these small details, you may notice something interesting. Your readings begin to feel more consistent, more reliable, less confusing, and that's exactly what we want. Because when the numbers make sense, you can make better decisions. You can have more confident conversations with your doctor. And most importantly, you can feel more at ease about your health. And there's still more to talk about because some of the next mistakes are even more common, and they often happen without people even realizing it. It's very common, especially when we're in a hurry, to just wrap the cuff over a sleeve. It feels quicker and easier, but clothing, even thin fabric, can interfere with the measurement. It can prevent the cuff from applying pressure evenly. It can create small gaps or uneven compression. And sometimes, if the sleeve is tight and rolled up, it can act like a band that restricts blood flow. All of this can lead to readings that are higher or lower than your true blood pressure. So the best approach is simple. Place the cuff directly on your bare skin. If you're wearing long sleeves, gently remove your arm from the sleeve rather than rolling it up tightly. It takes just a few extra seconds, but it helps ensure that what you're measuring is real, not influenced by something as simple as fabric. Now let's move into something that's less about technique and more about how we interpret the numbers. Have you ever taken your blood pressure once, seen a high number, and immediately felt worried? That reaction is completely understandable. Those numbers can feel very personal. But here's something important to remember. Blood pressure is not a fixed number. It changes throughout the day. It responds to stress, movement, emotions, sleep, what you eat, even how you're breathing in that moment. So one single reading, whether it's high or low, doesn't tell the full story. It's like checking the weather by looking out the window for 5 seconds. You might catch a gust of wind or a passing cloud, but that doesn't tell you what the whole day looks like. What really matters is the pattern over time. If you rely on just one reading, you might think your blood pressure is higher or lower than it truly is, and that can lead to unnecessary worry or false reassurance. A better approach is to take multiple readings and look at the average. For example, when you sit down to measure, take one reading, wait about a minute, and then take another. Sometimes you'll notice that the second reading is a bit lower because your body has had more time to relax. Over days and weeks, those readings begin to form a pattern, and that pattern is what gives you a clear picture of your health. It removes the guesswork. It replaces anxiety with understanding. And that understanding is powerful because when you know your true baseline, you can make decisions with confidence. You can talk with your doctor with clarity. You can adjust your habits in a way that truly supports your heart. And speaking of habits, there's one more thing that's becoming more and more common these days. Wrist blood pressure monitors. You may have seen them advertised. They're compact, easy to use, and convenient, especially if you find upper arm cuffs uncomfortable. And while they can seem appealing, they come with some important challenges. The wrist is a much smaller area, and the arteries there are closer to the surface. For an accurate reading, the device needs to be positioned very precisely, right over the artery, and your wrist needs to be held exactly at heart level. That might sound simple, but in practice, it's surprisingly difficult to do consistently. If your wrist is even slightly too low or too high, your reading can be off, and small movements can affect the result as well. That's why many experts still recommend using an upper arm monitor whenever possible. It's generally more reliable and easier to position correctly. Wrist devices aren't necessarily wrong, they're just more sensitive to positioning, which makes them harder to use accurately day after day. And when it comes to something as important as your blood pressure, consistency matters, because at the end of the day, it's not just about getting a number, it's about getting the right number. A number that truly reflects how your heart and your blood vessels are doing. A number you can trust. And when you start making these small adjustments, paying attention to timing, positioning, consistency, you begin to take control in a very real way. You move from uncertainty to clarity, and that clarity is what helps you protect your health, one reading at a time. And when you start to see your numbers more clearly, something interesting begins to happen. That fear, that uncertainty you might have felt before, it starts to fade a little, because now you're not just reacting to numbers, you're understanding them. And that brings us to one more important idea that ties everything together. It's not just how you measure your blood pressure, it's how you think about it. A lot of people treat blood pressure like a test you either pass or fail. One high reading feels like bad news, one normal reading feels like relief, but your body doesn't work that way. Your blood pressure is more like a story than a snapshot. It tells you how your body is doing over time, not just in one moment. Think about a day in your life. Maybe you wake up feeling calm, then something stressful happens. Maybe a phone call, maybe traffic, maybe just a busy morning. Your blood pressure rises a bit. Later you relax, maybe sit down with a book or watch TV, and it comes back down. That's normal. Your body is always adjusting. So when you take a reading, what you're really doing is capturing a single moment in that ongoing story. And that's why consistency matters so much. When you measure your blood pressure in a calm, steady way, same time of day, similar conditions, proper position, you begin to build a pattern. You start to see what's normal for you. And once you have that pattern, everything becomes clearer. You can recognize when something is truly different. You can see trends over time. You can have more meaningful conversations with your doctor because you're not just bringing one number, you're bringing a full picture. Now, I want to pause here for a moment and say something important. If you've been making some of these mistakes, you're not alone. Most people do. In fact, many of these habits are incredibly common, even in medical settings. So this isn't about doing something wrong. It's about learning something new. And the good news is, every single one of these mistakes is easy to fix. You don't need expensive equipment. You don't need complicated routines. You just need a little awareness and a few small adjustments. Empty your bladder before measuring. Sit comfortably, with your back supported and your feet flat. Rest your arm at heart level. Give yourself a few minutes to relax before taking a reading. Be mindful of caffeine and alcohol. Use the right cuff size and place it on bare skin. Check both arms once in a while. Take more than one reading and look at the average. Choose a reliable upper arm monitor whenever possible. These aren't big changes, but together they can completely transform the accuracy of your readings. And that accuracy matters more than most people realize, because when your readings are accurate, your decisions become better. You avoid unnecessary worry. You avoid unnecessary medication. And just as importantly, you avoid missing something that truly needs attention. You give yourself the chance to respond early, to make changes, to protect your heart and your health. And at this stage of life, that's what it's all about. Not chasing perfection, not stressing over every number, but understanding your body well enough to take care of it wisely. Now let me ask you something. How do you usually measure your blood pressure? Do you sit and take your time, or do you do it quickly in between other things? Have you ever checked both arms? Do you take more than one reading, or just one? There's no judgment here, just curiosity, because the more you reflect on your habits, the more you can improve them. And I'd really love to hear from you. If you feel comfortable, share your experience in the comments. Maybe you've noticed your numbers change depending on the time of day. Maybe you found a routine that works well for you. Or maybe this is the first time you're hearing some of these tips. Your experience might help someone else who's watching and feeling unsure. And if you found this helpful, take a moment to give this video a like. It helps more people discover this kind of information, people who might need it just as much as you do. And if you'd like more simple, practical guidance on staying healthy, feeling strong, and living well as the years go on, consider subscribing to the channel. Because your health journey doesn't stop here. There's always something new to learn, something small you can adjust, something meaningful you can do to support your body. And the truth is, it doesn't take dramatic changes to make a difference. It takes consistency. It takes awareness. It takes those small, quiet habits that you practice every day. Measuring your blood pressure correctly might seem like a small thing, but it's one of those small things that can have a big impact. It gives you insight, it gives you confidence, and most importantly, it gives you control. So the next time you sit down to check your blood pressure, take a breath, take your time, set yourself up properly, and know that in that moment, you're doing something important for your future. Because taking care of your health isn't about reacting when something goes wrong. It's about paying attention, making thoughtful choices, and staying one step ahead. And no matter your age, that's always within your reach. Here's to steady hands, clear numbers, and a heart that keeps you moving forward, one calm, confident step at a time.